it is with great pleasure and privilege that I'm able to present SB 810, our single-payer universal health care reform bill. And I'm here speaking for literally millions of California advocates who are committed to seeing this reform so that we can not only contain costs, save California's economy, but also provide accessible, quality health care for everyone in California. Do you know how much we spend on health care in this state today? Over $200 billion annually. Over $200 billion. Now, when Senator Sheila Kuehl first presented single payer on this floor, 2006, we were at about $165 billion annually. And when she introduced it again and presented it on the floor in 2008, we'd grown to $180 billion annually. Now we're at $200 billion annually. As a percent of our GDP, we've gone from about 11% in 1986. We're up to 17% today. Predictions are that we'll hit 20% in just 5 years and 25% by 2025. A quarter of every dollar this state produces will be spent on health care costs. And today, we're spending twice per capita compared to all of our Western trading partners who have universal health care for everybody at half the cost. You know, I was slightly embarrassed for some of the media reports as this bill came out of appropriations last week because they reported that, gasp, this bill was going to cost California $200 billion. No. $200 billion is what we are currently spending. And if we don't contain costs soon, as I've already described, this will become ever more expensive. So what this bill does, and what this single-payer plan does, is takes that $200+ billion and puts it into a fashion scheme that will make better use of those dollars by removing this 30% administrative waste that we currently have with a for-profit middleman that comes between the consumer of health care and the provider of health care. We know with Medicare, there's a 5% overhead, so there is enormous savings just in that administrative waste. So there's no new spending in this bill whatsoever, and no new spending in this plan. In fact, according to the Lewin Group analysis of 2005, there would be $343 billion saved on health care costs in this state in 10 years, $8 billion in the first year alone. So employees as well as employers will spend less under a single-payer plan than they are currently with today's rising premiums, deductibles, co-pays, and out-of-pocket expenses. Take all of those costs compared to the single-payer premium that every employer and employee would pay, and they will be saving money. You know, a major component of our budget structural deficit, the imbalance in our budget, is the rising cost of health care. About a third of our budget is related to health care costs. But the costs are rising 3 to 5% faster than our tax base. And that's how we pay for our health care costs at the state. So this is an imbalance that is only digging us deeper into the hole every year. So you can do the math. A third of our $82 billion budget spent on health care, going up by 10% every year, $2, $3, $4 billion every year additional health care costs on the general fund. But our general fund is not growing at that rate. So we cannot keep up. And this is why we see the governor proposing eliminating health care for 200,000 children this year. We haven't got the money in the uncontained system. So, you know, as Americans, we all love our country so dearly, and we know we're the best and the greatest in so many areas. We've led the world. I won't delineate in all the ways. So we want to believe, and sometimes we deceive ourselves to think we're the best in everything. But when it comes to health care, we're not. And you don't have to take it from me. You can take it from the World Health Organization, which did a study and looked at access to health care cost of healthcare outcomes, life expectancy rates, infant mortality rates, and we rank 37th among nations. 37th among nations, just above Slovenia. And again, paying twice per capita to rank 37th. You know, this is not unlike the banking debacle we've all just experienced, where the banks were more than pleased to take all the risks to increase their profits, and God forbid should anything go wrong, and we certainly found out how things could go wrong, the taxpayer would make up their losses. Well, it's not unlike the current system. The for-profit insurers are quite happy to take their ever-escalating premium dollars from us, as long as we can keep up with the payments, and as long as we're well. But if you actually need expensive health care with your coverage, you're dropped. And who picks you up? The taxpayer will have to take care of your health because, of course, the last provider is the emergency room at the county hospital who's going to take you no matter what. So we can't compete in a global marketplace where all of our competitors have had their governments take the burden of health care off the shoulders of employers. General Motors reports that about $1,500 to $2,000 is an additional cost on every one of their automobiles relative to health care costs of that employer. Toyota, European manufacturers, they don't have that cost. And that's one of the reasons we can't compete in the global market. Starbucks reports that there's more health care than coffee in your cup. They spend more on health care than they do on coffee. The Stockton Unified School District has voted in support of single payer because they did a study and realized that they could save $10 to $17 million annually so they can better provide education, not waste it on a failed health care system. And the Los Angeles Unified School District voted unanimously in support of single payer because their estimate showed in the first year alone $100 million savings for that school district. So the Federal General Accounting Office, the Congressional Budget Office has confirmed the dozens of studies that show single payer health care contains costs while achieving universal coverage. There are no reports that conclude otherwise. And the RAND study documents that by lowering health care costs for employers, they're able to then employ more. And as we move towards single payer in this state and have better, universal, less expensive coverage, this will attract employers to California. So I just will conclude, and I know we'll have a healthy debate here, that we are already underwater with our healthcare system. I've already shared with you the numbers. We can't keep up. The costs are rising because there's no containment in our system right now. And with the potential lack of success in Washington, though I know we all wish them well, it gives incentive to state legislatures to show leadership on healthcare reform. So in this failed system, which we can't keep up with, keep in mind, we've got a baby boomer generation about to move into its senior years. We have epidemics of childhood obesity and type 2 diabetes, of Alzheimer's disease, of autism. We're going to have ever greater demands on our healthcare system. Now is the time for reform, and I would ask for your aye vote.